Hi, I'm Dr. Hal Sessions here at Rock Creek PCC. We've got these new electronic analyzers that allow us to let you study some of the physiology principles on yourself. It's called the BioPac unit, and we're going to explain to you today how to do the one on the respiratory system. It's actually exercise 37A in your textbook, and it's about, the idea is to have you understand the different pulmonary volumes, the amount you breathe in, the amount you breathe out, and so forth. Melissa's going to show you how to hook it all up to hopefully save you a lot of time and little problems that we've seen arise. But let me just show you the basic concepts that we're going to be going over today. Up here on this slide, I have a picture of the pulmonary ventilation volumes that we study in A&P. And you notice that the basic volume that we is the amount that we breathe on a regular breath. It's like the tide going in and out. It is the tidal volume in and out. It's usually about 500 cc's in the average person. Now, obviously that depends on their age and their size, and we can talk about that at another time. But at the end of a tidal volume, when you've breathed out, there's a volume that you can breathe out beyond that called the expiratory reserve volume, the ERV. And you notice that's here, and so that's another volume we'll be able to test for today. And then at the end of a tidal volume, when you've taken in a regular breath, the amount that you're able to inspire beyond that point is called the inspiratory reserve volume, or the IRV. So, the volume that means the amount that you can breathe from the most you can take in to the most you can let out. From the most you can take in to the most you can let out is called the vital capacity. And that includes your inspiratory capacity there, which is the amount you can inspire from the end of a regular tidal volume being breathed out. Now, obviously there is some volume in the lung that you can never ever breathe out. So we can't really test for that here. But you know, when you go to the grave one of these years, you're going to still have a little bit of air in your lungs, and that's what this residual volume is down here, and you don't have to worry about that today. So these are the numbers that you're going to be able to measure on yourself and see what you can do. And just one last point from a clinical point of view, because we used to send patients to the pulmonary function lab to get pulmonary function studies done frequently. The most important pulmonary lab function is actually what's called the FEV1, and that's the forced expiratory volume in 1 second. And so that's another number that you ought to look at here. And the way you do that is you'll go in deep, all the breath you can take in, and from that point there, how much can you breathe out in 1 second? And nobody can breathe 100% of it out in 1 second because of the resistance of your air tubes. But as you have lung problems, that's the number that really goes up, so you can breathe out less and less. And so the FEV1 is an important number. Okay, just so you know, guys, you all have this in your lab book. This is the most recent edition of the cat version of the Human Anatomy and book by Marib. And if you look back here to exercise 37A, this will have all the information that you need to do this lab. And right over here is where you actually start the BioPac exercise, and it tells you how to hook the pieces up to a computer and then how to actually do the test, which you're going to see us do here in just a minute for you. Now, Melissa's going to take you through the equipment and show you how to hook it up piece by piece.
Hi, I'm Melissa. I am the Anatomy and Physiology Tech here at PCC Rock Creek, and I'm going to show you how to use the equipment, how to set it up, and which order to do that in. The first piece is the BioPac unit. It'll tell you to make sure that the unit is turned off, but on our units they're always off until you plug them in, so don't worry about that. You'll just plug it in, and then you'll open up BioPac Student Lab, and you'll select Pulmonary Function, number 1, and then type in your name, probably the name of your instructor, and then a number assigned for each table is the easiest. And now we're going to calibrate the transducer. So first, this is the airflow transducer. We're going to plug it into channel 1 here on the BioPac unit. Make sure it's tight. not too tight, but firm. And then before you calibrate, you have to have the transducer upright, because that's a position you're going to use when you're breathing in and out. So when you want to get a baseline reading. So then you'll hold it upright, steady, and try not to move it at all, and you'll click calibrate on the screen. And after 4 seconds, it'll tell you to read the instructions on the screen and then click OK. Make sure you do that. Don't click OK until you've read all the instructions. It's going to tell you that you need to attach your filter. This is your bacterial filter. 1 per person. They're disposable. And actually, if you've got this, if you have it set up correctly, when you're holding it, the cord will be facing toward you on the transducer. Then you'll have the filter, and then this is the calibration syringe. So that's the proper setup. So you're going to hold it like this, and then you're going to pull the handle all the way out, and then it's ready to calibrate using the syringe. So that's when you'll click OK. And then you're going to simulate 5 breath cycles. In, wait 1 second, and then slowly pull it out. It should take about a second to pull out. And once you've done that, you'll click End Calibration on the screen, and you should be ready to go. Take a look at your data that you have here on the screen and compare it with a picture in your lab manual. It should look similar to the picture in your lab manual. If it does, then you're ready to go. So you remove the syringe, and then you're going to place the mouthpiece on.
Okay, now she's just breathing regular tidal volumes. This is kind of the way you're doing it. And then you're going to take a really deep vital capacity breath. So ready, set, deep breath, deep breath, deep breath, deep breath, deep breath, deep breath. And blow it out, 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 blow it out. All you can, all you can, all you can, all you can. Good. Now breathe regular. Stop.
Okay. The things you need to know when you're analyzing the data are how to select data using the I-beam tool. In this section of the screen, you'll click on that, and that allows you to highlight a section of the wave. The next thing you need to know is how to zoom in on a certain section by clicking the magnifying the zoom tool, and then clicking on the section of the screen that you want to highlight. And the next thing you need to know is how to then adjust the display so that you can see everything. So you'll go up to display and you'll select auto scale waveforms, and then that allows you to see all of the wave that you're trying to analyze. And then the last thing you need to know is how to select different types of data, wavelength, your frequency, and all you do is select up here where it says minimum and maximum, and that'll allow you to choose any analysis that you want to do, and you'll just click on it, and then it'll display that analysis next to the button for the wave that you're looking at. And then your book will walk you through how to enter that information and then how to analyze it further after you've done that on the screen. So the point of the exercise is to allow you to take one of these charts that you'll see that you'll generate from doing the exercise, and then relate that to an actual breath so that you know what a tidal volume is, what a lung capacity is, and where that information, where that data comes from. So you don't have to spend a lot of time doing calculations or measuring each individual wave in your graph. All you really need to know is when you look at that graph, what does that spike mean, and where does that information come from, and then how does that relate to what's actually happening in your lungs. And that is the take-home message from this exercise, this BioPac exercise.